Hello, it's Dr. Rhonda Johnson. Today is January 23rd, 2022, and today I'm going to be talking about monoclonal antibodies. Folks, if you had the Delta variant version of COVID in 2021 like I did, you may have received a monoclonal antibody treatment that was manufactured by pharmaceutical companies Regeneron and Eli Lilly. Sadly, Omicron has mutations which the pharmaceutical manufacturers have acknowledged render these treatments ineffective against Omicron. Our nation's top public health experts and medical experts say that these older monoclonal antibody treatments are useless now. However, folks, they are still being given in some U.S. states. Now, I realize many patients are desperately sick with Omicron and looking for miracles, but you need to know that these older treatments are not likely to help you. But what monoclonal bodies treatments are available? There are two that are effective against Omicron. One is made by pharmaceutical company AstraZeneca. It's called Evusheld. It's a long-acting monoclonal antibody prevention shot for the most severely compromised people who won't respond to the vaccines because they're so immunocompromised. The other one is sotrovimab by GlaxoSmithKline and Vir Biotechnology, and it's also in extremely short supply. Most hospitals have limited number of doses that are reserved for the most highest risk people who have had, for example, stem cell and organ transplants, who have mild to moderate COVID and are at risk for severe hospitalization and death. These newer monoclonal antibodies work just like their predecessors. They block the virus from attaching to the cells, so if they're not getting in, they can't cause the severe tissue and organ damage that they're programmed to do. So we have to remember, folks, that like Omicron and Delta, the vast majority of people who are dying continue to be the unvaccinated. So, folks, the best protection you have against severe COVID disease remains the COVID vaccine, a booster shot, masking, ventilation, and avoiding social gatherings with a lot of unmasked people. A lot of us say we're tired of this pandemic, but the virus does not have pandemic fatigue encoded in its genes. So to summarize my message today, the older two monoclonal antibody treatment therapies don't work against Omicron. Omicron now is more than 99.5% of all U.S. COVID infections. The two monoclonal antibodies that are effective against Omicron are in short supply and limited to the highest risk patients. That's my message today.